Ever feel like you have sand in your eyes or your mouth is so dry it's hard to speak? Most of us blame these on screen time or dehydration, but sometimes these symptoms are more than minor annoyances. They can be early signs of Sjögren's syndrome. Sjögren's is an autoimmune condition where the body's immune system attacks its own moisture-producing glands. This leads to persistent dryness and can affect your quality of life far beyond just discomfort. Imagine your immune system as an orchestra. When it goes off key, it targets your own tissues, causing inflammation and widespread issues. Sjögren's is systemic, meaning it can impact multiple organs, making it tricky to diagnose and manage. In this video, we'll explore what Sjögren's is, who it affects, how it's diagnosed, and practical ways to manage it. Our goal: to raise awareness and empower you with knowledge about this often overlooked condition. Understanding your symptoms is the first step to taking control of your health. Sjögren's syndrome is a chronic autoimmune disease, meaning your immune system mistakenly attacks your own body, especially the glands that produce moisture. The main targets are the lacrimal glands, for tears, and salivary glands, for saliva, leading to dry eyes and dry mouth. But Sjögren's isn't just about dryness. It's a systemic condition that can affect joints, skin, lungs, kidneys, blood vessels, and nerves. There are two types. Primary Sjögren's occurs alone, while secondary Sjögren's develops alongside other autoimmune diseases like rheumatoid arthritis or lupus. The underlying problem is the same: the immune system turns against the body it's meant to protect. This can cause a wide range of symptoms, making each person's experience unique. The overlap with other autoimmune diseases can complicate diagnosis and treatment. Recognizing the systemic nature of Sjögren's is key to understanding its impact. It's much more than just dry eyes and mouth. Early recognition can make a big difference in managing the disease. Dryness is the hallmark of Sjögren's. Dry eyes can burn, blur vision, and increase infection. Risk dry mouth can make eating, speaking, and tasting difficult, and lead to dental problems. But the impact goes further. Many experience profound fatigue that rest doesn't fix. Joint pain and stiffness are common, often resembling arthritis. Some develop nerve issues, numbness, tingling, or burning in the hands and feet, known as peripheral neuropathy. Brain fog can make concentration and memory a struggle. Dryness can also affect skin, the respiratory tract, and in women, cause vaginal dryness. Some people develop a persistent dry cough or digestive issues. The range of symptoms shows how much the immune system's confusion can disrupt daily life. No two cases are exactly alike. Recognizing these diverse symptoms is crucial for early intervention. Sjögren's is a whole-body condition, not just a matter of dryness. Sjögren's syndrome overwhelmingly affects women. About 9 out of 10 patients are female. Most are diagnosed in their 40s or 50s, often around menopause, suggesting hormones play a role. But it can affect anyone, including men, children, and people of all backgrounds. Having another autoimmune disease, like rheumatoid arthritis or lupus, increases your risk. Genetics matter too. If a close family member has an autoimmune disease, your risk is higher. Still, no single factor guarantees you'll develop Sjögren's. It's a mix of gender, age, genetics, and other autoimmune conditions. Why does Sjögren's develop? There's no single answer. Genetics load the gun. Certain genes make you more susceptible. Environmental triggers like viral infections may pull the trigger, confusing the immune system into attacking healthy tissue. Hormones, especially estrogen, likely influence risk, explaining why women are more affected. The immune system produces autoantibodies that attack moisture-producing glands. This combination of genetics, environment, and hormones creates the chronic inflammation of Sjögren's. Research is ongoing to better understand these triggers. Understanding your risk factors can help with early detection and management. Diagnosing Sjögren's can be a long, frustrating process. Symptoms often mimic other conditions and may be overlooked for years. Patients might see multiple specialists for dry eyes, dental issues, or joint pain before anyone connects the dots. There's no single test for Sjögren's. Diagnosis relies on a combination of symptoms, medical history, and specific tests. Blood tests look for autoantibodies like ANA, anti-SSA, RO, and anti-SSB, LA. Eye tests, like the Schirmer test, measure tear production. Mouth tests assess saliva flow. Sometimes, a minor salivary gland biopsy confirms the diagnosis. Early diagnosis is key to managing symptoms and preventing complications. If you have persistent dryness and fatigue, don't ignore it. Talk to your doctor. Connecting the puzzle pieces early can make a big difference. There's no cure for Sjögren's, but symptom management can greatly improve quality of life. For dry eyes, use artificial tears or medicated drops. Punctal plugs can help keep tears on the eye surface. For dry mouth, sip water often, chew sugar-free gum, and use saliva substitutes. Good dental care is essential. Brush, floss, and see your dentist regularly. For joint pain and fatigue, NSAIDs or medications like hydroxychloroquine may help. Severe cases may require immunosuppressive drugs to control inflammation. Treatment is tailored to each person's symptoms and needs. Newer biologic therapies are being explored for difficult cases. The goal: relieve symptoms, prevent complications, and protect your organs. Managing Sjögren's goes beyond medication. It's about daily habits. Stay hydrated, carry water and sip often. Use a humidifier at home to ease dryness. Protect your eyes with sunglasses and take regular screen breaks. Brush and floss after meals, and see your dentist more often. Pace yourself, break tasks into smaller steps, and schedule rest. Gentle exercise like walking or yoga can help with fatigue and joint stiffness. Build a support network. Connect with others who understand your journey. Support groups, friends, and a caring healthcare team make a big difference. You're not alone. Practical steps and support can help you live well. Persistent dry eyes or mouth shouldn't be ignored, especially if you also have fatigue or joint pain. Early action is crucial. Keep a symptom diary and share it with your doctor. Early diagnosis means earlier treatment, better symptom control, and fewer complications. Don't hesitate to seek help. Describe all your symptoms, even if they seem unrelated. Awareness shortens the path to diagnosis and improves outcomes. If these symptoms sound familiar, talk to a healthcare professional. Taking action is a sign of strength and self-care. Remember, this video is for education. Always consult your doctor for medical advice.